Next case, health officials in Texas confirm the country's first sexual transmission of the Zika virus. Now, earlier this morning, I spoke to the director of the Centers for Disease Control, Dr. Thomas Frieden, about this. Here's what he had to say.
We've seen actually previously one case of apparent sexual transmission of Zika years back, so we know it's possible. And we had reports yesterday from Dallas with a test confirmed in our laboratory at CDC of someone who was not a traveler developing Zika, presumably, apparently, from sexual transmission.
This is quite a development, everyone, and Dr. Manny is here to cover it. So, it can be transmitted by mosquito, we think, and now transmitted by sexual activity. Yeah. This expands the nature of the challenge and the anxiety level, doesn't it?
Well, listen, we're playing catch-up again. The reports about sexually transmission have been out there for a while, and this confirms it, this case in Texas. And the problem is we still don't know exactly what the broad spread of this disease is. If you look at some of the statistics that are coming out of Brazil, Colombia, Venezuela, it's still all over the place. What we do know is that this virus is expanding, that we're seeing more cases here in the U.S., that is transmitted by a mosquito, that this virus does affect pregnant women, especially if they get the virus earlier in their pregnancy, and leads to microcephaly, which is a very devastating congenital malformation of the brain.
It's a terrible thing.
And we don't have a cure, nor do we have a vaccine.
So the level of anxiety is justified.
It is justified.
I mean, we're used to these medical scares, and we're used to them.
Listen, we pay the price every time we forget about these types of viral diseases, diseases that are spread by, let's say, mosquitoes. And, there's been no mosquito control for the last 15 years. So you're paying the price. When you go back to the days of the yellow fever, because this is something that is not in their radar. They don't use the proper money, the resources. The health departments around the planet do not talk to each other. Do
you want to go back to DDT?
I do, as a matter of fact. As a matter of fact, I think we should go back. As long as it's not used for industrial use. If it's used for domestic use, it is a very, very good, way of controlling mosquitoes. But now, of course, they're experimenting with genetically modified mosquitoes to destroy them. So we have a mess in our hands, and what you're going to see is a lot of more cases of this congenital malformation.
So our anxiety is
justified, and the CDC better get their act together.
Dr. Manny, thank you very much indeed, sir.
You got it, sir.